Hi and welcome to Step Strides with me, Connor Ratcliffe, and we're back in the garage gym today looking at some potential loading strategies for our peroneals. Today's exercise is a seated tiptoe raise modified for peroneals, and similar to some of our weight bearing exercises, we're going to look at some similar cues. So make sure we target the peroneals a little bit more and get a bit more plantar flexion eversion. We're going to look at cueing loading under the first, or feeling the pressure under this area, or feeling the pressure underneath the big toe. Again, as in other videos, anything we need to do to get the patient to kind of resonate with that modification to make sure that we're getting that added eversion. Now, there's some similarities to our weight bearing tiptoe raises, both single limb, double limb, modified for peroneals. So I hear you ask, why have another exercise? Well, the seated version of this means that we can be semi-weight bearing, so we've got an easy regression. We can reduce the load if we need to, and then we can gradually incrementally add extra load, and we'll look at ways that we can easily add additional load. So there's built-in regression and progression without us having to change exercise. The other benefit to this is that we're in a flexed knee position. So what that means is that we can make gastrocnemius actively insufficient, which means as a big, powerful primary plantar flexor, it's not going to work quite so well in that sagittal plane plantar flexion action, which means we can make peroneus longus, peroneus brevis, those weak plantar flexors, work a little bit harder in the sagittal plane action. We can also look at easy ways to modify range of motion, and we'll kind of look into those as we go through this exercise today as well. So it's a deceptively simple one, but lots of little tips, tricks, cues and modifications to make sure we're going to get the most out of it for our patient. So to begin with, we'll start with the easy version of this, and all you need is to be able to sit down. So I'm on my bench today, but anything works, and we want that nice bent knee position. We're going to come up for a count of 1, hold for a count of 2, come down for a count of 3 in our typical 1, 2, 3 second tempo to get that eccentric bias again. And if we want to add a little bit more load, we can get our patients to lean forward, push down on knees. Otherwise, if we just want semi-weight bearing, then this is our setup. So we'll do a few reps with the different variations, and we'll go from there. So we're going to come up, we're going to engage our cue of feeling the pressure underneath the big toe, and come down really nice and slowly. Up, pressure on the big toe, down nice and slowly for a count of 3. And if I want to add a little bit more weight, I'll sometimes say to patients, try and sort of sit in a position that makes it look like you're about to get up. You're going to push down on your knees to stand up. So as we push down, then we can add a bit more resistance. Still all the pressure through the big toe. We can engage our kinesthetic cues. We can push down in that area, feel the pressure here, feel the pressure here. Again, whatever we need to do to make sure we're getting that plantar flexion eversion, which makes it the modified for peroneals bit. So nice and easy, but a couple of points if we want to modify this a little bit more. And when we're setting our patients up with this, we need to be aware of the foot position relative to the knee. So the further we are in front of the knee, the more we're going to put our foot into a relatively plantar flexed position compared to leg. So when we compare the foot to the tibia and the leg, it's in a plantar flexed position. Now that's going to reduce the range of motion a little bit, and that's going to make it a little bit easier, especially in the sagittal plane with regards to that plantar flexion element of this. As we move back and we make it perpendicular, we get a little bit more range of motion. Again, always feeling that pressure underneath the big toe to make sure we're getting more of that eversion for peroneals. And then if we move the foot further back and we sit a bit further back behind the knee, then you can start to see that angulation. So now we're putting the foot into a relatively dorsiflex position, and that's going to increase the range of motion in that sagittal plane and put a bit more stress and stretch through our peroneals. Because they sit around lateral malleolus. This position really puts them on tension, and it makes gastrocnemius actually more actively insufficient because we're putting more flexion through knee. So in this position, then we can come up, load under first, come down nice and slowly, come up, load under first, come down nice and slowly, and you can see the increased range of motion that makes us work through. Neutral, relatively plantar flexed, less range of motion. Now, I promised you some built-in progression. So we've got built-in progression by modifying the sagittal plane range of motion and the relative plantar flexion or dorsiflexion of foot to leg, but there's more. We can have some additional progression by adding load. And this is a really easy position to add load in. So, got my dumbbells. It's a nice and easy setup again for this. And often you can actually put quite a lot of load through, but obviously it has to be appropriate for patient, their tolerance, etc. And our setup for this is going to be that we're just going to sit them on our thighs. And again, it means that there's not a grip requirement. So you can add load to weight bearing tiptoe raises. And in this instance, modified for peroneals. But you've got to have grip strength, or you need wrist straps to hold the dumbbell, or you can add a backpack, something like that. But this is a relatively easy position. You just need, obviously, the equipment. So we're just going to rinse and repeat. We're going to come up for 1, hold for 2, come down for 3, but feeling that load underneath our big toe. So up and down, nice and slowly. Nice and slowly. Then you need to have control over the weight still, but it's a relatively straightforward way of adding quite a lot of additional load if you need to do that. So we have that built-in progression to exercise. So that's our double limb tiptoe raises, seated, modified for peroneals. And just like in our other videos, if you haven't watched them, go and check them out. When we've been doing weight bearing versions of this, we're still going to be doing this for reps. So just bear in mind you might want a nice soft mat. Do it on a towel. You can do it in trainers, but that will modify the range of motion in the exercise a little bit. Typically makes it a bit easier. But what we don't want to do is overload forefoot. So that's hopefully a nice fun exercise, bit of a 2 for 1, and that's our seated double limb tiptoe raises modified for peroneals.